Hi and welcome. I'm Dr. Steve Grinstead. This is my Freedom from Suffering Now blog, and today I want to present an incredible opportunity to you. For those of you who are in the healthcare field working with people with chronic pain who also have coexisting problems including addiction, you need to do this. You need to come see me December 10th through 12th in Sacramento, California, right here in this room, where I'm going to be conducting a 3-day, 20-hour addiction-free pain management certification school for helping participants learn how to work with patients managing pain and coexisting problems including addiction. It's an incredible opportunity. In fact, a lot of people have come to this workshop who are living with their own pain. They would call and say, well, Steve, do you think I'd be able to benefit because I'm not a clinician, I'm not a healthcare provider. Will I be able to understand it? And I says, oh yeah. Because I teach this in earth language, because many of the people we work with as healthcare professionals don't have our certifications, our advanced degrees, our licensure, so we need to be able to meet them where they're at. And I really believe in working with people and not on people. Don't even hesitate. There's a link below here, this video, to where you can sign up now for this incredible opportunity, because our space is limited here. And when the seats are full, the seats are full, so don't delay. This will be an opportunity to get some very good strategic tools, and after you watch this video, read the remainder of my blog. If you're watching this on YouTube, go to the link below to the blog to learn about some strategic steps that you're going to learn in this incredible 20-hour event. There's also a link where you can sign up now and make sure that you get your spot reserved, because again, we are limiting this to between 15 to 20 people, because I want to have it be dynamic, experiential, and this will be like no other training you've ever been to. It's very experiential. I'm going to be talking about certain clinical protocols in down-to-earth language. I will be demonstrating how to implement those with different people. Then you will have an opportunity to get with partner or partners and start practicing these clinical interventions. Then we'll come back. I'll also show you how a lot of these different interventions can be used in a group setting. It's going to be a wonderful opportunity. Some of the things you'll learn is how to help patients differentiate between physical and psychological emotional symptoms. The psychological emotional symptoms I'm also calling suffering. So we can help people eliminate their suffering. Pain's inevitable. Suffering can be dealt with. There's many other things that you will learn: how to put together a multidisciplinary treatment plan, how to connect people with non-medication based interventions, how to develop pain flare-up plans. This is an overwhelming problem. The Institute of Medicine put out a report a couple of years ago that talked about chronic pain becoming a national epidemic and over 100 million people suffering with pain. Most people who go in for pain management at some point are prescribed opiates or benzodiazepines or both. If we use a conservative 10% estimate, about 10% of people who are taking these type of medications will experience problems. Not all of them will be addiction problems. Some of them will be dependent upon the medications, where if they stop, they'll go into withdrawal. Some people will be abusing these medications. They're not taking them as prescribed, or they're taking other things with them. They're taking them too frequently, too high a dose. Sometimes they're not taking them soon enough. That can be an abuse problem too. Then you're chasing the pain. And yes, there is also a condition called pseudo-addiction. And basically, to put it really simply, this is undertreated or mistreated chronic pain. And of course, some people develop an addictive disorder with their prescription meds, even if they don't have a genetic or family history. Some people can experience this problem. This workshop is experiential, it's dynamic, it's fast-paced, and people really get to know each other. By the end of the training, a lot of my participants really have a hard time saying goodbye to the people that were there with them, because they got so close. And they bonded and created and forged networking opportunities that will last them for a long time. There's many reasons to sign up now. The big one is because space is limited. The other is because you owe it to yourself. You owe it to your clients. It's really important. This population is one of the most underserved populations around. The research is really clear about this. Most people do not get adequate pain management, and they end up suffering. Some of them develop secondary problems, depression, anxiety disorders, sleep disorders, trauma disorders. There's all kinds of problems people experience. You can make a difference. The other great thing is once you finish the 20-hour training, you'll be eligible to present a competency portfolio and become competency certified in addiction-free pain management. You know, this is really a system that's based on sound principles and research from the American Academy of Pain Management, American Academy of Pain Medicine, the International Association for the Study of Pain, and the addiction and relapse prevention is based a lot on Terry Gorski's 45 years of addiction treatment and relapse prevention treatment. It's very solid, down-to-earth tools that when you leave, you'll have a call to action list that will develop throughout the training, that you'll be able to have this amazing toolbox that you'll be able to make a difference right away. So please, don't hesitate, join me. We like to consider this our home away from home, and my partner Ellen and I love to have people come. It's going to be a wonderful chance to meet other people and learn how they do it. A lot of times we get doctors, nurses, clinical therapists, counselors, and like I said earlier, even people who are just living with their own pain condition. And I will demonstrate how to be effective. We'll be using my addiction-free pain management workbook as a major training manual for this process. You know, don't hesitate. Sign up today and join me. I can't wait. It will be such an amazing opportunity. Thanks.